Hi, I'm Dr. Bill Sabbagh, and I'm going to demonstrate to you, my prospective rhinoplasty patients and those who've already had their nose done, how to care for your nose post-operatively. So when you leave, you're going to get a bag like this, and in the bag you're going to have some things: peroxide, and you'll have some gauze, and you'll have some Q-tips. And when you leave the office, after surgery, this is what you'll look like. So you'll have a splint on. There's going to be a piece of tape here, and then it's held on with the strap. Rubber band, gauze. So for the first couple of days, it's normal for you to drain a little bit. And what you need to do is clean your nose. So you would just lift the rubber band and remove the gauze. And then you'll get the Q-tip saturated with peroxide. You can put this much of the tip of the Q-tip in, and you'll have stitches here. So you want to clean this really good by usually twirling it. And then also in the nostrils, just clean around. I tend to find that right up here is where you'll build up most of the scabbing. So you need to twirl and clean and get the peroxide and the Q-tips wet, and then just get a dry Q-tip and dry it off. You don't need to rub or anything. But if you come back at the first appointment and there's scabs and there's blood and everything, then it hurts a lot more to get your stitches out. So if you keep it clean, heals better and easier for me, easier for you on your first appointment. Now, the splint itself sits on your face straight like this. And I have had patients bump it. I've had them take it off in the middle of the night by accident. And so you leave it alone. But if by chance you need to adjust it, let's say you find that you wake up and it's crooked, you have to put it back on, but you can't move it with these wings. You have to grab this strap and move it back and forth, and that's how you get it straight on your nose. And then you can put your fingers under these wings and make sure that they're the same distance from your cheeks. So I don't want you to move the splint, but if by chance it becomes bumped or moved or falls off, you at least possibly know how to put it back on. So hopefully that will help. Make sure you keep your area, your nose clean. And when once you've cleaned it, you take a gauze, and I usually just fold it in thirds, put it back underneath, put the rubber band down, and then you're all set. When it stops draining, 2 or 3 days later, you can just cut the rubber band off of this splint. You don't need to have the rubber band on the whole week. So you just cut it off, and then it'll be easier for you. Obviously, any questions afterwards, you call the office and one of the nurses can answer those questions. Thanks.